by profession is a nurse and a midwife both in Nepal. And while I am enrolled in the training, I have a period of the childbirth experiences in the hospital. And then I was so impressed that the midwives has the independent role to save the mother's and the newborn's life. And we must be adequately prepared. So when I got this opportunity, taking birth with the women, conducting the histories with the women, providing care to the women, and I've noticed that I need further training. So I went for the master's postgraduate training in India, South India, and there I have been graduated with a master's degree in the maternal health, and then I have started the midwifery career.
Tell me a personal story, somebody who was a name, somebody that you helped. Do you remember one story that's important?
Yeah. While I was with my students in the community field, and there we have the students need to conduct the delivery in the home setting itself, and we along with the students we used to go in the community and conduct the delivery. So during that time the woman was apparently all right. So when she gave the birth, and immediately it was followed by the postpartum hemorrhage. There was profuse hemorrhage, and we have been trained that the students also has been trained, and we the teachers also has been trained that how to care a woman with the postpartum bleeding. And so as far as we came to know, and in the community there is no other higher centers and no time for the referrer. We know that if the woman has been not taken care at the right time, we can lose the lives of the woman. So immediately we have checked the urinary bladder. It was full, so that the patient was bleeding and the placenta was not delivered. So when we put the urinary catheter, very simple method, if we have the good decision, if we are prepared well, we can save the lives of the woman. So the very simple method, the urinary catheter I have inserted, and then massaging the uterus with one dose of oxytocin, and it was normally the placenta has been delivered. So these are some evidences we have experienced that the midwives should be well trained, and then only they can save the lives of the woman.
Okay, that's a very powerful story.
Yeah.
Thank you. I have two more questions for you.
Definitely.
Tell me, from the two sides, from the patient side, what are some of the major challenges that patients face in order to find a midwife? Is it the husband? Is it the money? Is it the roads? What are the major challenges?
If we take a consideration with the Nepal context, Nepal is the full of mountainous country, and we don't have the road access. And we are in the Nepal, it is fully socio-culturally, it has been strongly binded. So the husbands always take the decision, either the husband or the mother-in-law. So the woman had no right to seek for the further help. And the family members always, they take it very lightly. So the women are depriving these midwifery skills. So definitely we should work with the women, we should know about their problems, we should extract from them the more their problems, and then only we can manage them accordingly.
Okay, and from your perspective, what are some of the major challenges that midwives face when they go into a community?
Yeah, we do have lots of challenges from the client's perspective and our profession perspective, because if we are not trained properly, suppose now also in the Nepal we have been not trained properly all the midwifery skill. The nurses are providing the midwifery skill. We don't have the separate midwifery education in Nepal till to date. So we are not in the global standards of the midwifery, so that we will have the independent practice. We are the dependent, and we are the medical model of care now at present. So we have the lots of challenges providing care to the women. We are not independent, we are not authorized to do, but the few skills it has been provided by the government that we call the skill but attendance training, where we can use our life-saving skills when it is needed and when it is indicated. So this is the professional challenges. The other side is the women's challenges. So the women are very reluctant to come in the health institution, and they should get the permission from the husband and the mother-in-laws. And again, if they want to come in the health facility, they don't have the money to get the travel, and then the road access is not good. So that in some rural context, it takes 2 days to become in some higher center. So by the meantime, she may lose her life. So these are the challenges we are facing, and we are appealing and we are lobbying with the government to have the midwives gather very soon, who are very professional and who are very independent in the future.
Thank you very much, Kiran.